Good morning, everybody. How you doing? My name is Lady Weirdness, and welcome back to another surgery game called it was laparoscopic gallbladder surgery. There we go. Having trouble with your gallbladder? Here we're gonna learn how we're gonna get rid of it. Let's go. Gallbladder, surgery, To be honest, my mother is the only person I know of who has gotten her gallbladder removed in my family. So, interesting fact. Clearly trained. Whoop-ah! Click, click, click. Okay. Here we go.
Hello, and welcome to Surgery Squad's virtual laparoscopic cholecystectomy. I'm Dr. Susie, and I'll be guiding you through this procedure today. Your gallbladder is basically a place that stores bile generated by your liver. As your body digests fats, your gallbladder pushes bile into the common bile duct, down to your small intestine, to help digest them. Gallstones form when the bile hardens into small pieces that block the common bile duct. These stones can consist of calcium, blood, and cholesterol, and they can cause moderate to severe pain, along with nausea and/or vomiting. When this happens, it is called a gallbladder attack. Gallbladder removal is the best treatment for gallstones. There are two types: open gallbladder surgery and laparoscopic cholecystectomy. Open gallbladder surgery involves one large incision and removal of the gallbladder. It is performed when the laparoscopic method is not possible, or when complications or too much scarring from previous surgeries are found, or when the patient's blood won't clot well. This type of surgery causes more pain and longer recuperation time. A laparoscopic cholecystectomy, however, is the most common and often the best method to remove a gallbladder. It is where the gallbladder is removed through several small cuts in your abdomen. The surgery is safe, and folks who have it normally recover within 1 week. There are a number of benefits to having laparoscopic cholecystectomy. Among them, you'll be able to eat food without pain in most cases. It eliminates any discomfort in the stomach lining, and in some cases, it relieves your upset stomach. However, if you have your gallbladder removed, you might experience chronic diarrhea, indigestion, trouble digesting, severe liver problems, fatigue, and rare but intense abdominal pain. The patient waiting for us has been suffering from pretty severe gallstone pain, so it is imperative we get his gallbladder out. Let's scrub up and get going. Our patient is already under general anesthesia, thanks to our nurses and anesthesiologist. We're going to make 4 small incisions, 1 right below the belly button, and 3 others right over the abdomen. First, we'll disinfect the area where we're going to make our first incision.
Can I doodle on him? Can I doodle? Dude, you look like you got a paintball on your skin. Whee! That all I can do?
Good. Now take your scalpel and make a small incision right below his belly button.
It lady stabs him. Oh my gosh.
Nice and clean. We've got to see where we're going, so we'll first inflate his abdomen with a little carbon dioxide to have some room to work.
He's gonna inflate like a balloon. I wish I could get a side view of this.
Now we'll use this laparoscopic camera to help us see where we're going. We'll watch our monitor as we go. Slow and steady. You're doing a great job.
The sound of it.
And there it is. I'll take care of the other incisions for our laparoscopic tools. Now that all of the trocars are in place, can you move the liver out of the way using the clamp so we can get to the gallbladder?
Oh, it's connected to the bottom of it.
We should have plenty of room to work now. Before making any incisions into the gallbladder, we'll need to clamp off the bile duct in 3 locations.
I didn't know the gallbladder was purple.
Great. Now use the scissors to sever it. I'll hold the gallbladder in place while you work to cut it from the liver.
Are we going to take those clamps off?
Device to minimize bleeding.
Yeah, we're going to remove these clamps down here.
Fantastic. Looks like you've done this before. One last thing. Let's take our clamp through the cut under the belly button and pull this guy out.
Oh, it's like removing a little alien. Oh, gross.
Nice work. Our scope shows that everything's clean. We've removed the gas, so let's close him up and get him to a fast recovery.
Oh, and don't use staples, because when you laugh, it hurts. What about the other one?
Our patient is now in recovery. And
you are not the same dude as before.
We'll send him home when he's able to eat something and drink fluids easily. We'll also make sure he can walk on his own before we let him go. He'll probably have a small amount of diarrhea, and his doctor will probably have him on a special diet to follow for a few days. He should be ready to resume a normal life after a couple days of taking it easy. And that's how we perform a laparoscopic cholecystectomy. You did a great job today. While you're here, try your hand at one of our other surgeries here on surgerysquad.com.
I already did that one. Well, that was fun. It was interesting. Interestingness. You know what? Let's go do one more surgery. These surgeries have been going by really, really quick. You know what? Let's do an eyeball surgery. We haven't done one of these in forever. We already did the cataract. Now we have retinal or LASIK. This looks like a very infected eye. Let's do it. Retinal detachment eye surgery. Ba, 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 ba. Pooh! Let's do it. Dun, 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 dun.
Hello, and welcome to Surgery Squad's Retinal Detachment Surgery. I'm Dr. Jeff.
Hi, Jeff.
And I will be guiding you through this procedure today. The retina is located in the back of your eye. When we see, light enters the eye. It is focused onto the retina, which acts like the film in a camera, feeding information to the optic nerve, allowing you to see. As you get older, the vitreal fluid, which is the gel in your eye, can contract, pulling the retina away from the eye.
Oh, that does not look nice.
This contraction can cause a small tear in the retina, allowing the fluid to seep behind the retina, detaching it from the back of the eye. This can cause loss of vision. A retinal detachment is a very serious ailment that must be dealt with as soon as possible after discovery. Symptoms that you may experience with a detached retina include seeing floaters or frequent flashes of light, shadows appearing in your peripheral or side vision, a gray curtain moving across your field of vision, or a sudden decrease in your vision. Again, if you experience any of these symptoms, contact your eye doctor immediately. Today, we're going to perform a retinal reattachment called a pneumatic retinopesky. The surgery takes about an hour and can be done on an outpatient basis. Our patient today is a 30-year-old man who recently noticed flashes in his vision. His ophthalmologist dilated the eye and detected a retinal tear and a detachment. He recommended immediate surgery to limit additional loss of vision. Let's begin. First, we need to administer a relaxing sedative intravenously.
Oh,
this will make our patient drowsy, but not put him to sleep. Can you place the needle for me?
Oh, I don't like needles. So, okay, while I'm not paying attention about the needles, basically the eyeball is like deflating. That's kind of scary to have your eyeball deflate. Not good. Close my eyes. Do that. I still saw it. I hate needles so much.
Just prior to surgery, additional drops of anesthetic are applied.
hate drops in my eyes. It always makes me blink and then my eyes feel itchy.
We'll use a device called a speculum to hold the eye open wide during the procedure. Place the speculum for me, please.
I shall peel your eyes and brainwash your mind. Bleh. I've seen things.
Now that the patient is anesthetized, we insert a syringe into the eye.
Yeah, see, it's like it's deflated. Your eyeball's deflating on the inside. Boop.
Now we inject an air bubble into the vitreal fluid.
Really? Oh, no, this just got interesting.
As the bubble expands, it pushes the retina back against the wall of the eye.
That still gross if the needle got stuck in the eyeball.
With the retina back in place, we can now seal the tear using a freezing probe. The probe is touched to the outside of the eye where the tear is. This freezes the tear back in place. It may take several touches depending on the size of the tear.
What? How do you see? I don't see a tear at all. How do you people see a tear? Action is done with a laser.
The tear is now repaired. The needle insertion will heal quickly. Can you remove the speculum?
Are we just going to leave an air bubble in his eyeball?
Our patient needs someone to drive him home after the surgery, and he shouldn't drive until he regains sight in the eye. We'll prescribe medicated eye drops to use several times each day for a few weeks after the surgery, and he'll need to wear a protective eye shield while sleeping or napping for about a week after surgery. A
or just sleep on the side that's not injured.
Also need to be worn to protect his eye from sunlight and other bright light as his eye recovers. However, the biggest part of the recovery is head positioning. The bubble floats to the top of the eye, so the head must be positioned to keep the bubble against the detached portion of the eye. This means the patient must keep his head facing down, or the position indicated by his surgeon, for at least a week. Sight returns slowly to the eye over several months as the bubble must dissolve and be replaced by vitreal fluid. However, once the bubble dissolves, vision is usually restored to close to the previous level. You did a great job today, surgeon. While you're here, try one of our other surgeries here at surgerysquad.com.
Hey, we did both of those. So basically the dude has to just keep his... basically just look at his feet all the time. He's gonna run into stuff. Okay. Well, that was fun. That was very much fun. Oh. Anyway, this is cool. I love doing surgery games like these. The first few surgery games that I did, I thought were a lot longer than this, but now it just seems like they're very short, and I can fit in 2 at a time, so. This is fun. I like this. This is about as close to Ed Heads as it gets. Because a lot of times Ed Heads, you have to pay for like membership for teaching to get the other games, like the surgery games and stuff like that. I have checked it out. The other games in Ed Heads sound a lot more interesting, and I'm not sure if I'll be able to do them, but I absolutely want to. But Surgery Squad is a very close second to Ed Heads. It's good. It's good. These are free to play on surgerysquad.com. Go and be your own doctor for the day. Do different surgeries. Have fun. Thank you all so much for... Just mess up my outro. Thank you all so much for watching. If you liked it, high five that like button. Like a pro. And I will see all you guys in the next video.